All right, from yesterday's numbers, those are the last figures that came through. South Africa's confirmed COVID-19 cases standing at 1,585. So in terms of the provincial breakdown, Mpumalanga currently has 18 cases. And the reason why we're focusing on Mpumalanga is because tonight we speak to someone in that province who was actually recovered from the coronavirus. We will not be mentioning her name this evening, as you will hear in tonight's interview the trauma she has suffered due to stigmatization. A very good evening to you, ma'am, and thank you very much for joining us here on The Full View.
Thank you, Chrisella, and good evening to you too.
I think let's start off with how you're feeling.
Currently I'm feeling quite relieved that I've been cleared, and I'm quite excited to be back in the world, even though we are in lockdown.
So talk to us a bit about how this all started. I mean, you started feeling well, I understand from what you told me earlier. You started feeling well after returning from a trip to the United States. Tell us what happened.
Okay, basically we have been saving for a trip to the USA for 2 years. So we couldn't let the whole corona pandemic stop us from going, because it was only a small outbreak when we left still. So we decided to continue with our trip. We flew back on the 7th of March via Dubai. We arrived in South Africa on the 8th of March. The evening we spent the night with my dad. And on the 9th, actually on our trip back from Dubai, I already started feeling not well, but it was only light flu symptoms, a little bit of a headache and some nasal congestion. When we arrived back in South Africa, on the 9th, we were driving home, and we planned to stop everywhere and say hello to all our family, because we've been away for 2 weeks and we really missed them. But as we got in the car in Johannesburg driving back, I said to my husband, I'm not feeling well. And he responded that he also didn't feel well. So I called our local GP in our town and asked for 2 appointments. On arrival there, we spoke to him, and he said to me, well, you've got a little bit of a wheeze on your chest, because I am a chronic asthma. I've got chronic asthma, let's say it like that. And he said to me, so he'll give me antibiotics and some cortisone. And then he said we should rather go for the COVID-19 test due to us traveling. So we went for the test, and I got my test results back on the 11th of March, the evening at 7 o'clock, and it was positive. I was devastated, and immediately I had my husband moved out of the room, because we're not allowed to have any contact anymore. That was the worst part for me, because you don't have anyone comforting you in this difficult situation that you're going through. But after all, I tested again on the 16th, and I tested again on the 24th of March. Both tests, 3 tests were done in Rob Ferreira Hospital. Yeah. And on the 24th, they gave me the good news that I have been tested negative twice. So on the 30th of March, they cleared me, and I am now back in reality, even though we are in lockdown.
I want to talk about what happened to you after the community around you had then figured that you had tested positive. I understand there was additional suffering that you and your family had gone through. Tell us a bit about that.
Yes, that was traumatizing, because I couldn't go back to work, obviously, because I had COVID-19, and I was under self-isolation from the 9th of March once I've tested. And couldn't go back to work, and everybody was talking about it due to the fact that the health department released and said we flew back on the 7th of March via of the 7th of March back from the USA. Everybody made the connection that knew me that it had to be me, because not many 27-year-old people live in our community that had flown to the USA. It was very traumatizing, because there was people sending messages around, broadcasting messages on WhatsApp, naming and shaming me, even my company that I worked for. It was horrendous, to say the least. It caused so much damage, not only to my company that I work for, but also to my self image. I'm broken because I can't imagine that a community that you belong to can treat you like that. It's just not right. I mean, I didn't go into contact with anyone. I self-isolated as per all the precautions that they gave me, and still they're treating me like this. And the only other thing that gives me a little bit of I know I did the right thing, is my husband never got COVID-19. I never, ever gave it to him, and he was the closest contact that I had. Due to good hygiene and regular sanitation and keeping social distancing, he never got it. So that's one thing I can say with a good mind, is I at least saved my husband from getting it.
Having tested negative just recently, you were telling me a bit earlier on when we spoke on the phone about the first time that you went out to the shops. What happened?
Yes. I went out to the shop the first time on Saturday, now, like in yesterday. Everyone was looking at me with big eyes and kept on asking me, what are you doing? You're not supposed to be. You're supposed to be in isolation. And the sad part of it is, due to them not having the knowledge that I, as a person, have recovered, they still treating us bad. So it's very nerve-wracking going into any store currently.
I mean, have you tried to explain to the community, or I see we're running out of time, ma'am. I think, after going through what you have been through, as South Africans observe the lockdown and others simply don't, what would you like to say to them?
Please stay at home. Isolation is the only option we have. Even if it is a struggle, only go out when it's really necessary. I had to have people deliver my food since I wasn't allowed to go out. Currently, we still have the advantage of going out and getting our own food. Please stay at home. If you do not comply with the self-isolation rules once you've been tested positively, you will end up in big trouble and resulting in fines and forced isolation. And you're going to put all your family and friends through the same traumatic experience as I had.
Unfortunately, we've run out of time. Thank you very much indeed for speaking to us. Speaking live from Mpumalanga there, we're unable to give identity this evening. You heard during that conversation, a lot of stigmatization is still going around. We're speaking there to a resident in Mpumalanga who has recovered from the coronavirus, but she says just on a Saturday, after going out to the shops for the very first time, she could feel how the community had treated her, not just her, as well as her family in that particular area where they are living. And I think that has been one of the major challenges for government at this stage, is to ask South Africans not to continue with the stigmatization of those who are believed to have contracted the coronavirus, those who have recovered from the coronavirus, or anyone who knows someone who has been affected by the coronavirus.